here we are with another episode of Project Gen XYZ with my co-host, Katrinaking. We have a guest for you guys today, a distinguished guest, Chandell Miller, who is a professor, a provider, and we are very happy to have him on today with us.
Thank you. Thank you for having me, and I'm happy to be here.
Great. So we'll just get into it. Tell us a bit about yourself, where you're from, what your intentions are when it comes to your aims and your goals. And yeah, let's get right into it.
Awesome. All right. Well, again, like you said, my name is Chandell Miller. I am a professor in Northern Virginia at Northern Virginia Community College.
Great.
I teach the substance abuse rehabilitation program. And I've been doing that for 11 years. And I'm originally from Philadelphia, Pennsylvania. Okay. So I've been in the Northern Virginia area for 14 years. So I am a provider of mental health and substance abuse. To me, they're hand in hand. I really don't like separating them, but
of course,
the way things are set up is separated. So I do both. I do mental health counseling. I'm a licensed professional counselor, and I'm a licensed substance abuse treatment practitioner in Virginia. So I have an outpatient facility, and I've had that up and running for 11 years as well. So in Philadelphia, I worked in the police department as a 911 dispatcher. I've worked with probation doing adolescents who were at risk. So they call it the delinquent side. I've worked in Camden, New Jersey with children from the state who were, state supported individuals, and they lived in a controlled environment. And I've worked in Washington, D.C. with the youth at the Youth Detention Center there and here in Virginia. So I've been spread out over a couple of states. And one of the things that I love too is on top of what I do, I've worked in entertainment. I worked in radio. I wrote books on music. I did a lot of artist development and artist management, things of that nature. So cool. I'm just a busy person.
So you'd say you're a Renaissance man of sorts?
Hey, thank you. I'll take that title.
There you go. All right.
But I'll tell you what, though, I have to be somebody's flexible. So sounds like you're right where you belong.
Speaking of your experiences in Philadelphia, do you notice any changes between the atmosphere out there and here?
Wow.
Specifically.
Great question. When I came here, I noticed immediately that the individuals in recovery were well informed.
Okay.
And I didn't necessarily have that experience in Philadelphia. They were very informed about, the street life.
Yes.
But here they were very well informed about how the brain works, this, that, and the third. So I had to change my approach. So I had to bring my level knowledge up a little bit. So I teach up. So I noticed that. So, and then I noticed the way that I'm gonna speak for Northern Virginia specifically.
Yep.
The way the policing is done is just different than it is in Philadelphia.
Well, I can imagine. I mean, in Philadelphia, it's probably a little bit different audience there. Your experiences with, I noticed you said delinquent. Do you feel any sort of a way about that? You said it in a way where I imagined you weren't very comfortable with that term.
Yeah, I don't like labeling. I just don't like labeling. Of course. People.
I feel the same way.
But the way they set it up, they call it, whenever you're dealing with youth with issues, they call it the dependent side and then the delinquent side. I don't know about that. How do you feel about that? I mean, I understand what they're saying, but the dependent side is I'm 7 years old and my mother and father are on drugs and they don't come home.
Okay.
So I can't eat. So what happens is, the state comes in and takes that child from that home and start giving them service. Then the delinquent side would be
like adolescents and things like that.
Yeah, this is, yeah.
But I've worked with that population for a long time. So let's say they went out and committed crimes. It was still the same as the dependent side. They were doing it because the parents weren't home, so they had to eat.
Exactly. So that's kind of what I was alluding to when I said, the difference in the atmosphere and the conditions in Philadelphia. Do you ever hope to return to Philadelphia or if you could see it, the educational aspect of Philadelphia? Because I feel like, man, if I was to leave my hometown for Northern Virginia, I'd always have some dreams of going back to my hometown and re-educating them in the sense of, we have to do better. We have to do better for my people. These are my people, and I want to see them succeed in life.
I love that question.
Yeah.
I'm a Philadelphia at heart.
I know it's brotherly love, man. The city of brotherly love. I know how it is.
That's where I grew up at, threw up at, and learned how to do my thing. So, I do see under the new leadership a lot of changes are being made. Okay. So I'm liking the temperature on that. I would not mind going back to work in Philadelphia because I understand it.
Yeah.
But it's such a large problem. You can't do it by yourself. You need the way the new mayor is having a task force. That's the idea. You can't just throw it all on police and say police this problem away.
Got it. Now, okay, so that opens another topic of discussion. From what you've seen to policing, the difference in policing from Philadelphia to here, any distinguishable differences?
Yeah, so here it's proactive.
Okay.
And Philadelphia is reactive.
That's new. Oh, this is new. Back when I was in trouble.
Yeah, well,
that's a different story, right?
Yes, obviously the ratio for change, they've made a lot of progress on that front. The only difference between here that I would say and then is they don't do enough cleaning up messes from before. That's what I would say.
True.
That's absolutely what I would say.
Well, going back, I think, Professor, we talked about this before, the laws that affected those who were impacted by the crack epidemic, for instance, crack versus freebasing or powder coke, and the differences in the sentences they got. And then now, I'm not disagreeing with it, but I'll see people come in for armed robbery, then they get run to jail right away because related to their substance use, but still have all of these individuals that are impacted, either still sitting in prison or when they get out of prison, they still have this noose. They're not going back and correcting. And I think that's wrong because I think violent crimes, I have my opinion on that, but I think they need to crack down on those more. But they need to do more across the board, but are passive about it. And I look at it and I think if somebody was trying to terminate themselves, we would get a temporary detention order. We would do something to try to intervene, but that is not necessarily occurring here. A lot of our prosecutors are advocating for people to I'm not in favor of them sitting in jail either if it's for simple possession. I don't know if you guys saw, but Oregon's getting ready to reverse the laws. They were allowing or decriminalizing substance use. Now they're reversing that. And they're going to make it criminal again because they said it got out of hand. Of course it did, because you didn't have the healthcare infrastructure to support it. And I know that's something that you've talked about before, Professor. So I wanted to ask you how you felt about our healthcare infrastructure. Everything from treatment to outpatient and everything else. How, do you think it's effective? And what do you think should be done differently?
That's a layered question too. When it comes to treatment, it still needs a lot of improvement. Yeah. We need advocates at the insurance companies. We need access. And when I say access, I went with somebody last year who was having a problem in Maryland. And they had 5 seizures in 1 week. So I talked to them. And he said, okay, I'm ready to go. I got on the phone 3-way with the insurance company who set it up. We go to the place and he had a seizure there in the emergency room. And I'm down on the ground like, I don't know what the heck to do. And he wasn't taking the seizure medication. Okay, yeah, because he's drinking. So he wasn't taking it. So they were all nonchalant. Hello.
In the emergency room?
Yes.
Oh my gosh.
Because it was a security person there. It wasn't.
Holy
And I'm
shit.
like, can you help me over here? So we get in the back, we get them together, and they're ready to discharge him in 3 hours. I said, wait a minute. I spoke with so-and-so, and they kept, oh, no, well, we want to put him up. So I stayed, and they didn't put him out. Then the next tour came on, and they kept trying. They said, look, you know more about this than we do. All we do is treat the symptoms and then discharge him. And I thought that was sad.
Stick him with a fat bill while you're at it.
And I think he was ready. He was ready to go in. We had everything set up, and it just fell through. So we need advocates there 24/7 because it's an emergency. So when somebody calls, you can't call back at 9 o'clock in the morning. No. So we need this access to healthcare. There have been some improvements, but of course there needs to be more, especially when it comes to detoxing, educating. I know the Caron Foundation is doing a lot with helping. The Caron Foundation is up in Pennsylvania. Okay. And they have been working with a lot of the medical schools to make sure they get addiction studies in their curriculum. So that stuff helps, but we won't see that until a couple years, okay. But at least they are addressing that now, where when you come into the hospital, it's not just, treat them and send them home.
Right.
Because you know what's going to happen when they go back home.
More seizures.
And that's what happened.
Then it's just bad. It's a cycle.
Yeah. So I think it needs some help. It has improved. It has improved some, but we need some advocacy, and we need to educate the users of this insurance how to advocate for themselves as well.
Okay. That's fair. Yeah, I really do think
he's right. He's right. You're right about that, because when we were found myself constantly advocating for individuals who would try to advocate for themselves, but would get one answer, and then I would call and I get a different one.
Yeah. Exactly. That's what seems to be the insurance companies. That's one barrier that I noticed was bigger, particularly bigger than others, like transportation. Even though that's a big one too. Transportation. All of the barriers that you can imagine for people with substance use disorder challenges or mental health, behavioral health, right? Mm-hmm. Insurance, I don't really know how. It just there needs to be more advocacy in that realm, because you're dealing with people who, if they're unable to advocate for themselves, they're not going to get an answer that they like. I think they need advocates who work for the insurance companies and have been in that position. Say, look, they see both sides of it. I've been this person before. I think this is what they mean when they're asking questions like this. This is what they, and at the end of the day, these insurance providers, they're I don't know what they're worried about the clinical aspect of it, if that at all. They look and they see these numbers on a paper and they see what they want to see, or they're just checking boxes at the end of the day. Whereas these people on the other side with behavioral health challenges, they could be having a meltdown, and it just results in a hang up. And then they see that as a reason to go back out and do the things they were doing. I think that's all resolved for somebody who has been on both sides of it. That's all I'm saying. I mean, I like that approach as well. One thing we have to think about when we think about insurance companies, they are huge, huge, huge companies. Yes.
And their bottom line is any other business. It's
exactly money.
So, but they have been advocates who've been talking to these insurance companies to show them how they save money when they give us the care.
That's perfect.
And then they've been saying, okay, we'll see how it works. Do it. And then they've been approving the claims. So that's why I said them advocates, and I know the Caron Foundation is doing a good job with that. Talking with these insurance companies to show them, if you keep denying the claims, your bills are going to go up because they're going to keep getting hospital visit.
Exactly.
Which is more expensive. So why not treat the whole person? You might have to put out, let's say, $10,000-$20,000 for treatment, and I may be being generous because I know there's other places at 30 and 40. You might put that out, but then if you deny that claim and you look over a year's time, you might have to pay out double that because people are going and do the I call it the oil change. Just go to the emergency room real quick and
get patched up and all that.
Right.
Yeah. Well, it's like Medicaid with the dental and some of the other aspects. We had to advocate, go to bat for that because we had to prove it's very hard for people to become employed and all that if they're missing most of their teeth.
Exactly. That's another barrier.
It affects your self-esteem. For better word, this is a society we live in. I didn't make the rules. They judge a book by its cover. Okay. So it's an obstacle. So they began to start covering that. So I do agree with you on the advocacy front. It's needed. And the thing is, though, in my opinion, the advocacy seems concentrated. And I'm going to say this because I am not one of those people that get on the whole trying to be
correct.
Whatever. I'm not that person. But I'm going to tell you, I do have a problem. I don't like when others speak for me. So when I've had academics or doctors, somebody else wants to speak for me, right, and speak for my experience. Now, you can't. That's my experience. So I'm speaking for populations they're not part of. I think we appreciate your advocacy. We appreciate that you're an ally. But I think that when you recruit and you start making space for people of all demographics to speak for themselves, that's when we'll get further. Because I think that a lot of people feel unseen. And this isn't just a racial issue. This is just age groups and, you know what I mean, socioeconomics, all of it. And I think it's it's a problem. The ones that are affected are not getting a chance to be a part of that, right? I don't know what your experience. I have no business doing. So when you're speaking about advocacy, do you feel that there's a lot of underrepresentation?
Most definitely. And I loved your example of the dental because Medicaid typically didn't cover that before.
Right.
I don't know if they're doing it now, but
They are
about that. You're going for a job and you're missing fronts.
Yeah.
You know, they're looking at you like, get out of here. So that's something that I wouldn't think about.
Yeah.
And I lived that experience and said, okay. And dental work with insurance is expensive. So
totally.
I do think that representation is major. When you see somebody that looks like you, sounding like you, like, okay, they can sit there and speak for me. Not saying that others couldn't, but when it's just historically been a certain demographic that represents the whole, that, like, let's say, I always say this term. They look at me and say, you're African American. I don't like that term.
I don't either.
And that's why I respect him. When I heard him say that, I was like, that's my man, because you're an American.
Yes.
Or just a person.
You're just a person. You don't need to
label. No label.
When I was working in DC, I was working at the jail, so they clearly knew I was not from that area.
Right.
So the guy kept coming, where are you from? So I knew what he was trying to say because I didn't understand his lingo. They didn't understand my lingo. So he said, where are you from? I said, I'm from planet Earth. No, I knew what he was saying, but I'm from the Earth. I don't know about these borders. I am from the universe.
Love it.
Saying,
love
Me
it
too.
Yes. But it just, because of the way the United States has been structured, it's typically, like you said, I didn't make the rules. Sounds like they're representing you, and it doesn't necessarily have to be a color thing. It just is, you can hear it.
Experience itself is like, you can't articulate my experience. You can tell me all about recovery all day, but you arrested, were you detained, were you kept in jail for doing something that now people are just let go of? Were you villainized, and were you sitting in a jail cell when your daughter began to use and died? No. So when I am empathetic towards, like, I've thought about it in my journey. Do I represent as a mom who lost a child? At first I thought about that, and then I realized I didn't fit into that group. I fit into the group of the person who was struggling, and I best represented my daughter by doing the same. Being truthful, honest, authentic. It's not always easy, but it has to be done. But you get my point. You're not going to fully on the prevention side. What are you thinking drove you or made you feel like that's where I would need to be focusing my energy?
Yeah, what got you into that?
Yeah.
Well, when you look at, you've been working this field for so long, and you keep seeing,
Bodies piling up.
Yes, and saying and the stories, and it's like, are we getting this message across?
Right.
And I'm not saying I'm throwing away recovery, because that's important as well, but we need to get the right message to these young people quick, because if we don't, let's say people who let me get this thing right, what they call vape and jewels and all these things, they're going to come with their message if we don't come with ours. And when they come with their message, it's backed up and supported.
Totally agree.
So I think about, I was on a training. I went to a training at the University of Penn. One of the best trainings I ever did. And it was on tobacco and nicotine use. So we did an anniversary, and we was online. So I was back here in Virginia, and somebody else was in there from Virginia, and she was upset. She was crying. And she was crying because this was 2 years ago. Because this July, marijuana will be totally legal, full throttle in Virginia. You can sell it and all that other stuff. So 2 years ago, they had set it up. So you couldn't sell it, but they were setting the stores up. So they set a store up in Arlington, Virginia. And the laws, you can't be so many feet away from a school with drugs. So the school fell into that distance. So
why would they put a store there?
Moved the school.
They moved the school?
That's disturbing. That's disturbing.
What?
Whoa.
You didn't close the shop. You moved the school.
They need a new school anyway? Was it
like breaking down at the foundation or something? Or they moved the school?
You know why they moved that school.
Oh my God.
That's bad. That is bad. Well, that tells you your priorities, doesn't it?
And some people say, well, that was a behavioral school. My point
exactly. It was still a school. Yeah, exactly. Right. Even more need for the education at that point.
And I'm talking about, it was moving quick. The landlord gave them 30 days to roll.
So the landlord,
who's the landlord of a school though?
Whoever
rental
property, so this lady who worked there, she was in tears. Like, I cannot believe they actually are going to move the school, and gave us a quick time frame to leave. So
we got to start finding out who these people are and their names and all that, man.
Well, think about it. We're capitalist country, and that's the money. That's where the money. I mean,
that's crony capitalism for you. Man.
I mean, it's sad. I just chose our priorities, because we'll say one thing, but we do something very different. And that's the truth. I mean, lyrics and everything else. I don't believe in regulating music, but there's a lot of sex appeal, for lack of a way to put it, that is infused into substance use. And I get raw. I'm gonna tell you, went to school and spoke, and I was more honest than ever. And but they shared the survey results with me after, and they said, this is what we want to hear. We want to hear the truth. The scare tactic worked, but we want to hear the truth. We want to hear it from all kinds of people. They didn't just say they want to hear from people who lived it, but they said want to hear from everybody, and they just want to hear the truth. They don't want to hear they're going to die from marijuana, but they want to understand why we're saying that. Weed. And I broke it down. I'm like, hey, I ain't got any problem. You just got to be honest with them. That's what they want, but that's not what these schools want you to do. They want you to go in there and first of all, they don't even want you in there because they want to pretend they don't have a problem. But if they do have you in there, they want you to be careful. You're not going to be effective that way.
Because a lot of parents don't want to hear it. They're scared.
That's the truth.
And one thing I learned when I moved to Northern Virginia, I wasn't familiar with the landscape. So I didn't know that Loudoun County was a well-to-do. But I found it. So I was going out there to the houses, and I was told, don't talk to my kid about drugs. Why? I don't, So then I talked to the other parents. It was an esteem thing. I don't want nobody to know my kid's struggling with drugs. It's going to make my family name look bad.
Yep.
So
Yep.
they didn't want you to come. And I'm saying, wow, that makes me want to give you more information.
Yeah.
Now, I don't want to find out the hard way about my child, so you had a lot of that. So a lot of these schools, they don't want to, they're scared about drugs because we've had the scare tactics for decades. 70, 80 years we've had scare tactics, and now you're saying that don't work. Well, you saw it didn't work.
Yep.
But so I think what it is, it's a balance. And when you say things that are not promoted because of an agenda that most places have as agendas, oh, we're only going to do da 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 da. So then you have to keep a message a certain way. I just was asked to come and be a keynote for the opiate settlement.
Ooh.
So,
the abatement authority, even regulating music, but there's a lot of sex appeal, for no lack of a way to put it, that is infused into substance use.
Yeah.
Went to school and spoke, and I was honest. They shared the survey results with me after, and they said, "This is what we want to hear. We want to hear the truth. The scare tactic worked, but we want to hear it from all kinds of people." They didn't just say they want to hear from people who lived it, but they want to hear from everybody, and they don't want to hear you're going to die from marijuana. I want to understand why we're saying that. I'm like, I ain't got any problem. You just got to be honest with them. That's what they want, but that's not what these schools want you to do. They want you to go in there and first of all, they don't even want you in there because they want to pretend they don't have a problem. But if they do have you in there, they want you to be careful. You're not going to be effective that way.
Because a lot of parents don't want to hear it. That's
the truth.
And one thing I learned when I moved to Northern Virginia, I wasn't familiar with the landscape. So I didn't know that Loudoun County was a well-to-do. But I found out. So I was going out there to the houses, and I was told, don't talk to my kid about drugs. Why? I don't. So then I talked to the other parents. It was an esteem thing. I don't want nobody to know my kid's struggling with drugs. It's going to make my family name look bad.
Yep.
So
Yep.
they didn't want you to come. And I'm saying, wow, that makes me want to give you more information.
Yeah.
And I don't want to find out the hard way about my child, so you had a lot of that. So a lot of these schools, they don't want to, they're scared about drugs because we've had the scare tactics for decades. 70, 80 years we've had scare tactics, and now you're saying that don't work. Well, you saw it didn't work.
Yep.
But so I think what it is, it's a balance. And when you say things that are not promoted because of an agenda that most places have as agendas, oh, we're only going to do da 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 da. So then you have to keep a message a certain way. I just was asked to come and be a keynote for the opiate settlement.
Ooh.
So,
the abatement authority in Richmond.
No, this is in all of the states got paid from a place in Pennsylvania.
Oh, okay.
Their money that was allotted to do some prevention. And he was like, well, make sure it's appropriate.
Yeah.
What do you mean appropriate? We're going to have kids there. Well, listen, we're not. What are you going to make drugs look cute and put it on a plate with ice cream and cake? No, we're talking about. Yes, I talk to them in their age. So I'm not going to talk to a 5-year-old
Age
about
appropriate.
They don't want to hear certain things. A lot of people are not happy about Narcan, and it's all over the place. So you do have to gingerly step into those shoes.
Mm-hmm.
But I like being as real as possible because it's about saving lives.
Yep.
Yes. And they tried that with sex education. Oh, well, don't talk about it, and they won't do it. Well, that didn't work. Right. They're like, okay, well, let's talk about it. Now they're talking about it, and you could talk about it. But you're right. Substance use is still, and mental health, but primarily substance use is that you want to be in denial. All these young people are dying. I just saw a woman the other day sharing her story. Same thing like you're talking about. Don't want people to know. I've seen a girl buried and her parents not even want to have a memorial for her because they don't want anybody to know. These things are awful. They're awful because it's so worried about what people think about you as a parent instead of actually trying to be that good parent. I don't know, man. I've seen it affect all of life, and I just
I know
I don't know.
the he died, the son died from drugs. They did what you did. They gave a private memorial just for the immediate family and told family members they died in an auto accident.
That's what my in-laws did on my Mexican, my daughter said she was in a car accident. So I started telling people, no, she didn't die in a car accident. Because we need to face these things, right?
It's
Right.
stigmatic.
We have to face it.
Of course.
The thing is, it's like that's not the way. But I saw a video I was going to share with you guys later. It's a guy doing a rap some sort on Suboxone, and he's like, I'm not saying Suboxone's bad, but the same industry that told us that this medicine was good for you and then we all died is now saying, well, now we have the cure, but you can't get off the cure. You could get off the drug, but now you can't get off the cure. And I've never heard a truer statement. And it's kind of sad because I think they could do better. But this is the problem I have with the youth is that I know that they're putting young people on that because they don't know what else to do. And I think it's great for short term, but the problem is that's not short term. It becomes a long term thing as their brains are developing. So then I'm like, you've created an opioid user for life, I think.
We watched a video on the DEA.
Mhm.
The way it was set up lovely, where there was supposed to be oversight. Well, it's no oversight. So now people are on the Suboxones 5 and 6 and 7 years, and it was not intended for that purpose. It was not intended for that purpose. And now everybody's relaxed. So when you say, come on, they're looking at you like, what do you mean? Get off. No, I'm going to somebody else. Because, but when you look at the culture here in the United States, we are 1900, going to the doctor and taking a pill was the last thing we did. Now it's the first thing we do for everything. And then when you look at the pharmaceuticals, let's say, because this area is very diverse. So we have people from all over the globe. They like, I'll just go to the pharmacy and I get it. I don't need a prescription to get Xanax, to get whatever.
Yeah.
They just get it and they don't abuse it. So, but here everything is pump it up, pump it up. You have to get a prescription for this, take a pill for that, take a pill for that. So, people are kind of
confused to say the least.
They're primed from a very young age. Take a pill.
They're primed. It's a great way to put it. Yeah, they are. Yeah. Brain chemistry, psychological messaging, all that is, this is what you do. I mean, I believe in talk therapy, but it's so hard to access it. Like I've needed it occasionally, even recently.
Right.
But by the time I try to figure out how to access it, I'm like, I figured my problem out. I'm good. I'm good for another couple of years. It's not good though, It's not good.
It's like you need a prescription for everything, man.
Yeah.
I'm not aware of what the clinical studies say or anything like that. When you said Suboxone wasn't meant to be on for however period of time, what did you mean by that exactly?
So what I'm saying, when Suboxone came out, it was, I'm gonna call it the miracle drug.
Yeah, that's what I think everybody who knows anything about Suboxone calls it.
Yeah. But you're supposed to do it in tangent with therapy.
Right.
So when the psychiatrist writes the script, it's not saying this is something that you're going to be on for 36 months. No, when I was saying it 6 months and under, when it first came out, was 6 months and under, and not everybody. That was the extreme cases.
Sure.
Maybe 8 months to a year, but typically under that time, and you go to therapy and get the therapy along with it, and then you titrate down. So you can
got it.
But some people say, well, what's wrong with taking it? A lot of professionals, medical professionals, well, if it's improving the quality of life, let them take it. So since it's not a full antagonist like methadone, they're saying it's not as harmful.
It affects liver damage, kidney damage, and
teeth
male pituitary
damage.
gland, dental damage, pituitary gland is affected. In fact, I had a young man that's hormones were off balance, and the endocrinologist had to work with him in tandem with his Suboxone. They didn't want to take him off of it. So that's very real, but no one ever advised me when I was given it.
Exactly.
And they didn't advise you. They're like, oh, you just titrate down till you're down to next. No, it doesn't matter if you're on 8 milligrams a day or you're on a peak. You're going to have the same exact withdrawal for as long as it is. It is
totally agree. There's a psychological component to it that goes in hand with the physical component. So you might feel one way physically, but that psychological anxiety is another beast in and of itself. It's just like I don't think people really understand that unless they've been in those shoes. Professor had one more question. Do you think that people understand, or clinicians or people understand enough about the titration of I understand that studies are going on and on and on and on. We're learning more and more and more about it, but I feel like we're getting away. How do you feel when you hear somebody say something as convoluted as, well, if it's keeping, quality of life and all those things, and that they lead to certain, side effects and things like that. Does that, as a do no harm, I know I clearly understand that you take that seriously. Does that sort of rattle you in any way? I couldn't imagine what it's like to be in that situation.
Well, I'll say it doesn't rattle me because where we live, you see what it is. But we're here for quick solutions. So it's a culture of quick solutions, and we have to understand that. So when I'm talking to a client, I want to individualize that. Do I think most counselors know enough about any of that medication? No, because you typically don't go to school for that. You understand it loosely and things of that nature. And you can say, well, maybe they don't need this, but it's really up to the doctor to do that. They're the ones who make that decision. You can give your input, but I do think we have a duty to go out and learn a little bit on your own and see things like this. You have to take that formal training.
Got it.
Even thinking about, I saw a program at the University of Penn. It was neuroscience. It was sick. You can take 4 classes or 6 classes. And pharmacology was one of those classes. So I'm thinking about taking them, but if you do, it's $10,000 out of your own pocket. So people don't, I'm not paying all of that.
Right.
But I like learning. So
exactly.
Why don't they have those in public university? I wonder. There are always these specialized courses that are not standardized across the country.
That only the big wigs can pay for or get access to.
Well, I don't have 10,000 laying around.
Exactly.
Most people don't. Yeah.
But what you do is you pay as you go for each class.
Yeah.
So if it's 4 classes, it's $2,500 a piece. Yes. But still, it's still a lot. But I do think we have that duty. It rattles me, but it doesn't, because I understand the way that the businesses work. So, but when I'm working with that client, we're talking about goals, 3-year, 5-year, 10-year. How does this look, and how does this fit into your life? So I do like the part where the quality of life is improving, but you want to get, it's this pharmacist I follow online, Dr. Price. He says he wanted us to go from the pharmacy to the pharmacy. He was a pharmacist, PHAR. He wants us to go to the pharmacy, FARM.
Food, like farm to table. Yeah, that's
food as a medicine. Yeah.
Food as a medicine. So that is the natural healer.
Totally.
So, but some people aren't with that frame of work. So I understand that, but I'm still working with them one-on-one, and I'm not judging. I'm just giving information, So, because if people aren't ready to come off of it,
to digest that. so to speak.
Yeah, we're going to digest
Yeah.
it. And it might
Yeah.
take 3 months for us to get comfortable with saying, okay, all right, I'm willing to step down and get off.
Press and let them to kind of guide themselves. I had one more question because I could go all day with you. So maybe we'll pick this up later. But on my end in closing, I hear that there's a massive shortage of providers or professionals in general in this field, and in the middle of a crisis. But my experience, not just my own experience working with providers, but also experience working with providers and coordinating care, is that, yeah, we have a lot of providers. Education isn't equal. Awareness isn't equal, and sometimes personality. So do you find yourself frustrated at times? Because as a person that seems very clearly able to be flexible and open-minded and wants to learn, do you find yourself frustrated when you see a lot of providers, even public agencies, who are like, they know it all, they don't need to learn anymore? It's just,
See it as a challenge, or do you see it as a challenge, a welcome challenge? I would definitely see it as a welcome challenge, to be honest. But that's just
I do see the field. What it is you get what you get. So when I'm training people, I'm training them not necessarily just to be an employee, because that's what most people do. They get all this education and then say, let me go work for somebody. When you go work for an organization, there's a lot of red tape. That's a shortage, because it's just like they liken addiction to a disease, same type of pathology like asthma, diabetes, cancer. So when somebody goes in to an emergency room and they say, I can't breathe, my asthma is bothering me, they go right back and they get treated. They don't ask any questions. They don't ask you your name. They put you on a ventilator because they know you can't talk. And if you keep talking, it's going to exacerbate the non-breathing.
Yes.
So when you come in and you have addiction, oh, well, we don't have a bed. Oh, come back in 7 days. What? So why is that acceptable? That's the part that gets me mad. So what I do in my practice, when somebody calls, they get in that week. There is no, oh, come 2 weeks or 3 weeks. No, that's ridiculous. You're being a diva.
Oh, man. You would love talking to my mom.
Sorry. I said, this is ridiculous when you think about the severity of this disease. My daughter was on a weeks-long wait list for Suboxone. When she died, she was going to be going to the CSB because she couldn't find any other provider in the area. I don't think that that's necessarily the case now with them, but there are still significant waits. So I appreciate you saying that. That you're like, come back later or after 5 o'clock, we don't talk to you. It's not exactly the way to manage
them, Stigma defined. Stigma.
Well, lack of education, I think,
exactly.
Because they have some providers going, well, you're not going to die from it. Here's some Gatorade and crackers. And then you have others that are more aware of what's happening. And it can be frustrating, I think, for somebody like you. So you're going to stay with the teaching thing as long as you can?
As long as I can. I love it. I love teaching. I love the flexibility in it. And what I love is about this is there are not many programs that focus on substance abuse in the United States. And as a matter of fact, the education system are trying to get away from it because, again, it's back to a money thing and a stigma thing. And people are like, well, substance abuse counselors don't get paid no money. They broke. So a lot of people saying, why go into the field? Why pay all this money if I'm going to be broke? So my message to everybody is you can work if you want to, but my thing is the more degrees you get in this field, the more you can do. So you don't necessarily have to take a low-paying job, but there's not many programs out there. So I like it for that, and I like it the fact that it's at a community college level, so you get a mix of everything instead of
a liberal arts sort of view to it.
That, and you get people straight out of high school, you get people straight out of penitentiary, you get people
you sure do.
It's something. I've been sober for a week, so you get it all.
I like that. I love that.
That's awesome.
And I love how Professor Michael, I don't think I've told you this, but whenever I've been vulnerable and I've heard the class go quiet, and I'm like, okay, you guys want to pretend That's cool. But I'll be vulnerable and share. It's hard to do. And you always respect that. I respect you for that, because it's like he appreciates the authenticity. He appreciates he's mentioned the honesty of the people in recovery, how honest and just real they are. So that's nice to you have that kind of support from an academic, because it is so rare.
Thank you. And it is awesome, because when people are bold enough and brave enough and safe enough to say that message, it does equalize it. And the people probably get quiet, because what do you say to a mother who's lost their child? You're like, hey, but the fact that she's brave enough to say it, it could save somebody else's life, to say, look, she didn't fall apart. She's still doing her thing. I know it hurts.
Exactly.
Yeah. Well, in the incarceration thing, it's a real hit for me to go through the whole process. We're plugged and have them, because of this charge. Now in July, that'll change. So I can work with kids now anywhere, whatever. Anyway, that was a challenge to go through all that and I'm mapping out my own path. I'm going to consult. It's coming along. And sometimes you have to go through a little bit to get there, but I know you're going to do great things. I think you really should embrace the prevention side, both from the education side. So speaker delivery is very important. And I think you would be very engaging. I think the young people would definitely listen to you. No doubt about that. So
I totally agree. Totally.
Yeah. What is your information? Any information you want to share? Are you interested in taking in new patients, or what insurances do you accept, or you want to share any of that, or you rather not?
Always open for new clients.
Okay.
And I'm even looking to expand. And I think I'm looking in the Fredericksburg area.
Okay. You're hiring people. You want partners?
I'm open. I'm open, because I want to step back and do more, so I don't have to do all of the direct work. So yeah, I'm open to a lot,
like delegation and stuff like that.
Most definitely.
Yeah. Okay. Well, I was sharing that because and I can't share with you yet, but I have a meeting, and I've been hired to create and prepare some materials for and like intervention stuff to parents and foster parents. So when you mentioned delinquent, I was like, so when I think about that, you have that experience already working with the juvenile justice system, which is really they're really overwhelmed right now. They really are. I remember, Michael, were you there? We had an overdose awareness at the George Mason Clinic, and we had one of the probation officers from the juvenile side come in. Resources. They were looking for like peer specialists, counselors that worked with youth and stuff like that. So do you work with youth?
I do.
Professor Miller? Okay.
I do. Not as heavy as I did in Philly and DC, but yeah. So I do.
You'll take an ad. Okay, good.
Yeah.
All right.
Cool. And I have somebody on the staff who has been trained in both.
Insurance, do you accept?
I do. And if you can let me share the screen, I can.
You guys have to forgive me because it's been a while. Oh, yep, I see it.
Allow others to share.
Allow others.
And I think I got it. Let me see. Yep.
Okay. Yeah, it should. There you go.
All right. So this is my website, my telephone number, my email address, and the physical address.
Awesome. And then I will go ahead and put those in our links as well on all the platforms.
And
awesome.
Insurance. Where's my insurance at? Services. Let's see. Oh, here. So we take Aetna, Cigna, United Healthcare, Oxford, Oscar, and Anthem Blue Cross Blue Shield of Virginia. And now we take federal
TRICARE.
Well, I take TRICARE as well. So TRICARE, I have to put that one up there. So TRICARE, and I take
Medicaid?
federal Blue Cross.
Does that include Medicaid or no?
No, now Medicaid, I don't, but I have partnered with some of the CSBs.
Okay.
So, but that takes a while to go through all of their paperwork.
Absolutely does. Like you said, red tape.
Yeah.
I'm telling you, he is a renaissance man.
Really is.
How else you want to put it?
No, he really is. He really is, guy.
He
Yeah.
is. I told you would like him a lot. And also I think anybody who's interested in pursuing a career in substance use counseling, I think going through Northern Virginia, Professor Miller's one, I think he's the only, or he's the chief instructor, right, on the addiction. Yeah, the only one. So to benefit from his smiley face and songs at the end of every evening.
Oh,
the
yeah.
end of every class. He coordinates us at the end. So it's been
Okay, I didn't know that.
Yeah,
Maybe we could work on
yeah.
a little jingle or something for you. I make music.
He's one. He's got one that
he
he
does?
sings.
Well,
Well,
I'll steal
somebody's.
everybody.
You got to
Yeah.
check, man. Oh, we can make an original one. How about that?
Sounds
I quote our theme, and you'll hear it when we publish the episode. It's awesome, and it's original. It's got skills.
Sure.
It's been quite a privilege. Nice, humbling. Thank you for taking your time.
Yes, thank you very much. It's been an
Share with
absolute
us.
pleasure, Professor Miller. Thank you very much.
enjoyed- And look, this is my first podcast, so
Wonderful.
I
Wonderful.
can't believe it.
Even better. Even
Yeah.
better.
If you're interested on being on more, I know several people in that. I'll just send
Yes.
you along, because there's people who do the podcast syndicate or whatever, and it gets the
Circuit.
word out there. Yeah, it's actually very helpful when you're trying to get speaker stuff and all that. So,
yes, I would love it.
all right,
Cool.
awesome.
Very cool.
Thank you
Thanks
guys.
for having me.
Absolutely.
Likewise. Have a
All right now.
True victims would rather be victimless and treated with dignity and respect without sympathy or neglect. But you can listen for less than it takes to give them a check. People just want to be seen and heard with empathy. A seat at the table where major decisions are made influentially, and all cards are left on the surface. Not a thing is inferred because it's an authentic exchange of ideas where the absolute truth reigns supreme.